So it's full-blown summer season with a heat wave at the moment. So it's really hot and humid outside. Many of us are spending more time outdoors, swimming, traveling, and also exercising. Other people are enjoying vacations as well because it's vacation season. Now, for some people, summer also means a lot of increased intimacy and sexual activity. Now, unfortunately, all of these activities can increase the risk of UTIs. That is urinary tract infection. So, let's talk about the causes, symptoms, treatment, and most importantly, how you can prevent them. Hello, my name is Aisha, aka Nurse Aisha. I'm a registered nurse and health advocate here to spread awareness on preventative health and lifestyle choices so that you can lead a healthier and more informed life. Welcome to my channel. Make sure to subscribe, like, and comment on these videos. So let me start by explaining what a UTI is. A UTI is an infection that occurs anywhere in the urinary system, including your bladder, your urethra, and also your kidneys. Most UTIs are caused by your own bacteria, E. coli bacteria, when it enters the urinary tract. This is a normal bacteria that lives in your lower intestine and your rectum area. Us women are more likely to get UTIs because of our anatomy, where the female urethra is shorter than the male's, making it easier for this bacteria to grow and thrive in the bladder or to reach the bladder. The most common symptom of a UTI is a burning sensation when you're urinating. Horrible feeling. It feels like razor sharp pain. It's really painful. This can usually be mistaken for a sexual transmitted infection like chlamydia, but a simple test at your healthcare clinic will determine what it really is. A UTI also has other symptoms that are very common, like frequent urge to urinate. Even when your bladder is not full, you still feel the urge to go to the bathroom and urinate. There's also that cloudy, strong smelling urine. Now, if you have worked at a nursing home or in geriatrics, you know what I mean. It really stinks. You can also see blood in your urine, and this is more of a serious symptom that needs medical attention immediately, especially if you develop fever, chills, nausea, or pain in your back or side. This can mean that the infection has reached your kidneys and you really should seek medical attention promptly. You should not wait if you see blood in your urine. Why are UTIs common during summer season? Well, first, many people get dehydrated because of the heat. When you don't drink enough water, you urinate less often, which allows the bacteria to thrive and grow, and they stay longer in your urinary tract. Secondly, spending time in wet swimsuits after swimming can create a warm and moist environment that encourages bacteria to grow. They love that type of environment. Thirdly, travel and busy schedules may cause people to delay going to the bathroom when they feel the urge to. This means that bacteria grows. And finally, summer vacations often mean increased sexual activities, which can introduce bacteria to especially the female urinary tract. That increases the risk, obviously, for an infection. Now let's talk about treatment. If you suspect that you have a UTI, contact your healthcare provider, take the test, and find out what it is. UTIs often require antibiotics to clear the system of the infection. It's important to complete the full course of medication, even if your symptoms improve quickly, because they do. But make sure that you finish the whole prescribed dose. It's usually only 5 days, but the symptoms can clear really quickly and you might think that you're free of the infection. don't do it. Don't do it. Don't stop your medication. Continue until the 5 days have gone. Now, how can you prevent UTIs? The best way to prevent UTIs is to drink plenty of fluids to help flush out bacteria from your urinary tract. Do not hold your urine for long periods of time, and make sure that you urinate after sexual activity. Now, if we're talking about hygiene or anything like that, make sure that you wipe from front to back after using the toilet. Make sure that you change out of your wet swimsuit and sweaty workout clothes really quickly. You don't want to stay in wet clothing for a long time. Make sure that you wear breathable cotton underwear. Maintain good genital hygiene or private hygiene, but ladies, avoid harsh soaps. No douching, because these products disrupt the natural balance of the healthy bacteria that we have in our vaginas. All you need to do is clean the vulva, the external parts, with clean warm water. There's no need digging inside the vagina because it's self-cleaning. You don't need to do any internal cleaning. This is a special message for older women. If you are in your perimenopause or menopause, you may notice that UTIs become more frequent. This happens because estrogen levels decrease with age. Lower estrogen can lead to vaginal dryness, thinning of the vaginal tissue, and changes in that normal flora, that healthy bacteria that normally helps to protect against infections. If you're experiencing recurrent UTIs and vaginal dryness or discomfort during intimacy or any type of irritation, make sure that you speak to your OBGYN or your healthcare provider, because there is help to get. Treatments such as vaginal moisturizers, lubricants, and in some cases, local vaginal estrogen can help. That kind of therapy may help you reduce symptoms and also lower the risk of reoccurring infections like UTIs. You should not have to accept frequent UTIs as a normal part of aging. There are effective options available. Also, please make sure that you stay hydrated, practice good hygiene, as well as safe sex during this beautiful season. Now, if you found this video helpful, please like, subscribe, and share with another woman who may benefit from this type of information.